So thanks for coming back, Lucas.
No problem.
I've had you on
My pleasure.
before when we've had like a bunch of people, but it's kind of more fun when we do less people, I think, sometimes, because you have more time to talk. We can kind of get a little more in depth. So that's one reason why I wanted to have you back. For those that don't remember, can you just give a little brief background, why you chose emergency medicine, why you chose med school?
Certainly. So my name's Lucas. I'm an emergency medicine physician in Colorado. I've been practicing emergency medicine for approximately 15 years. I chose medicine in general because it was challenging. It was helpful to other humans. It allowed me to use like the skills that I thought I naturally had rather than trying to cultivate ones that weren't really natural for me. And I think my path into emergency medicine, honestly, was pretty natural. A lot of people kind of struggle with what specialty they want to go into, and they end up going through medical school and really realizing that they're kind of disgruntled about what they thought each field would be. For me, emergency medicine was choice number one in the beginning, and I would do it all over again in a heartbeat. I really liked the challenge of the field. I like the lack of predictability. I like that there's not a problem that I'm not expected to solve. It doesn't matter what it is. It could be completely fabricated that no one in the world's ever seen, and I'm expected to be able to handle it.
Yeah.
Challenging but rewarding, certainly. I like the lifestyle, and I take a lot of pride in being a provider that people turn to me and to us and to the emergency department in general when they get turned away from everywhere else in the entire world. Mm. Oftentimes those are very frustrating patients, but there's also an honor in being the one who says, I will take you. Mm-hmm. I will take care of you. I will accept you. No one else in this world, the medical community won't, but I will.
Yeah.
And I take that part of the job very seriously.
Yeah.
So.
I think that is a cool thing about the ER is like we're not looking for insurance authorization for every test that we order. Like if you think the patient needs a test, you can just order it with, some limitations, but it is kind of nice that you don't have to fight with insurance over every workup and every test you think a patient needs, at least to rule out the emergent stuff,
Yeah, it's nice that I just show up to work and I practice medicine.
Yeah.
I really don't do anything else while I'm at work, so.
Right. Is there anything different about the ER than like when you were in med school and you were deciding on ER? Is there anything practically that's different about it than you initially thought?
I think maybe I was a little bit naive to some of the things, but I think that I got in medicine and in emergency medicine late enough, meaning like I didn't start in like the 1960s when emergency medicine was not even a thing and it was just beginning to develop itself. The term emergency medicine and ER is almost becoming an antiquated term because yes, we take care of emergencies, but really what we do is acute undifferentiated care. That is what the ER is. Mm-hmm. A lot of that is emergent cases, but a lot isn't. Mm-hmm. So the landscape of emergency medicine is changing, and medical screening, and a little bit more of a comprehensive look than just emergencies. I don't think that's necessarily a bad thing, but it is something that people who are getting into the field should be aware of. Mm-hmm. That eventually it's not all going to be nonstop excitement, but that's not a bad thing because, in all honesty, you couldn't handle nonstop excitement.
Yeah.
On a crazy shift where it's just emergent case after emergent case after emergent case and lots of chaos, like it's fun for that moment, but you go home feeling exhausted.
Yeah.
And the next day when you have an easy shift and nothing super crazy comes in, most people don't miss it the day after a super crazy shift. So I think it actually offers a little more balance, like the way it has become.
I think that's a good mindset shift. I tell that to the paramedics all the time because when I was a paramedic, you'd get so burned out by like, I can't believe we took 12 people to the hospital today and none of them were dying. We didn't intubate a single one of them. Like, what a waste of my time and my skills. But I'm like, if you were intubating every patient all day, every day, this job would burn you out too. Like, you can't let the low acuity patients burn you out. This is just part of the job. And some of those patients end up being something like, acute appendicitis or something. You just don't see that on the ambulance. You're like, another abdominal pain. This is probably nothing, it's probably just gastroenteritis. But I'm like, you can't let that stuff burn you out. Just enjoy the patients that don't test all of your skills. Because if you were using all of your skills on every patient, like that would burn you out in a couple of days too,
Yeah, it would be tough. It would be very difficult. And we would like to think that we could take on the world and we like nothing but the hardest cases. And the reality is that's not true. I don't think it's true for anyone. Even the most ambitious adrenaline junkies out there, they still need to balance out not just their life, but like each shift. I mean, I rely on non-emergent patients between my emergent patients to help like with my workflow of the entire day.
Yeah. I mean, we don't have, no ER really has the resources to deal with, resus patients every single time, like we need the patients that can wait on a workup. They don't need a whole bunch of interventions right away. It'd be rough if it was all resuscitation patients and intubations and central lines. That would get old pretty quick.
Yeah, it would be tough.
Have you ever had a period of time working in emergency medicine are you like 13, 14 years in?
About 15.
15 years.
Yeah.
Have you ever been burned out in that period of time?
Yeah, everyone experiences burnout. I think that a lot of people talk about preventing burnout. I think that you should accept the sensation of burnout, but your focus should be on how do you manage it. Because if your focus is on preventing it, then you're going to be upset when you feel burnt out, right? Like it's going to be like a disappointment. It's going to be an expectation mismatch. And again, you will feel burnt out. So you need to accept that. One, try and minimize it. Two, try and manage it. But yes, I feel burnt out frequently in ways, but I think that I've done a good job of like bringing it back to reality and managing it and changing your mindset a little bit, changing your actions a little bit, and to deal with it. But I think that if people who've been practicing longer than a year say they're never burnt out, I would question either one, the honesty, or two, their ability to assess what burnout is.
Yeah, that's a good point. What kind of symptoms do you have when you feel burned out, and how do you manage that?
I mean, it's really easy because there's a couple things. Most people feel fatigued in some way, whether it's tired, like you just want to sleep more, or fatigue as in lack of motivation. You're not feeling as ambitious, and that could be career related, and oftentimes it shows up in your personal life. Unfortunately, it shows up in your personal life a lot. You may put your best foot forward. You may be feeling a little like down today. Put your scrubs on, you go to work, and you put your best foot forward because that's what you're supposed to do. But then if you don't manage it, you go home to your spouse, your significant other, your partner, your friends, your kids, whomever it is that you socialize with, and you don't bring your best self. So I notice that I'm getting a little burnt out when I'm more irritable at home, when I'm not as excited about work, and also when things bother me more than what they should. So like some of the frustrating cases in the ER, there are days where I just find them humorous and work around them, and other days where it upsets me more, and that's probably when I'm feeling burnout a little more. And for everyone, it's different. It is different for everyone, and I think it's important to recognize those warning signs, because usually there's symptoms that you're feeling before you're aware of why they're there. So it's kind of like your check engine light, like, hey, something's not quite right, and you need to fix it.
Yeah, that's a good point. What kind of stuff do you do to mitigate it in your own life when you feel those symptoms coming on?
Something I've gotten a lot better at, maybe even just in the last 5 years, is consciously being aware that I'm not bringing my best to the table. Work, home, whatever it may be. And oftentimes that's a symptom of some type of burnout or something I'm not managing well, whether it's stress or lack of sleep or something else. So the first part is just being really hyper aware and ask other people. Like, there are times where you feel you're justified in saying a certain thing or doing a certain thing, but it's really not quite you. You know, you're off a little. You're not quite as friendly. You're not quite as like energetic. So maybe ask others, like, hey, how am I acting during this time? And becoming aware of Like, how are you as a person when you're feeling a little burnt out?
Yeah. Yeah, my wife's probably the first one that would be like, you're burned out probably well before I even realize it. Like,
Yeah.
why are you so irritable? Why are you just sitting around instead of playing with the kids? That kind of stuff.
So recognition is number one. Doing it early, offering those who are close to you to help you recognize that, to help you notice when you're not being your best person. So recognition, number one. And then number two is like, you can't just do what feels natural all the time. You kind of have to have a plan before it happens. When you're feeling well and when you have all the clarity in the world, you need to say like, okay, when I'm starting to feel burnt out, what do I need to do? Is it realistic to work less? Oftentimes not. Maybe over a long run, but you can't make those changes short run. So it's optimizing everything else in your life, optimizing sleep, health, eating well, exercising. For me, a lot of it is really personal relationships, like really leaning in on my wife and apologizing for when I've been irritable and making an extra effort to be an extra good husband, an extra good dad will make me feel better as a person, and it will make me feel less burnt out. And for me, exercise is huge. So that is something that's just a maintenance every single day, every single week, eating well, exercising. That prevents burnout a lot. And if I'm burnt out, it's easy to say, okay, I have to sit down and, get to the grind for a while and finish a certain project or a certain thing. But it may be much more beneficial just to get outside and get some fresh air. Go for a walk, go for a hike, ride your bike, whatever. If you have hobbies, sit down and read, write, draw, whatever it is that you do.
Yeah. Yeah, we've talked about that before. The like taking care of yourself before you're taking care of patients does a lot, I think, to kind of prevent yourself getting into that burned out mode. If you've already exercised for the day and eaten well, you've packed your food, you're not relying on garbage that you're just going to eat in the ER throughout your busy shift, you're not hydrating. Like if you do all those things, like I feel like burnout's harder to come by, not impossible still, but at least it lessens that hard shift if you've already done things for yourself in that day. I think that's probably my biggest one too, is just getting up early enough before my shift that I do the things I know are going to keep me healthy and in the right mindset before I go in and deal with the inevitable chaos that we're going to deal with.
Yeah, I'm huge on mindset, and a lot of people just kind of seem to feel they're victims of circumstances often, whether it's a bad shift, a mean patient, a bad case, lack of sleep, a week of just a lot of like tough shifts timing wise. But you've really got to kind of have a plan before going into it. And you got to have a way that works for you, because it's not the same for everyone. So you have to know what works for you, and you have to have a plan to take action, and take action early rather than letting it fester and build and build and build. And then it's just a lot harder.
Yeah.
We've talked about burnout. We talked about cases in the emergency room being emergent versus non-emergent. And you kind of have this mindset of what a shift should be, or what a job should be, or what a title should be. And oftentimes reality is very different. Something I found for me that helps in the ER setting is I need, and I've never failed to find yet, at least one encounter, one case, one conversation in a shift that is truly enriching. All I need is one. Most days I have way more. It could be something as simple as some patient just being really grateful and really sweet. That's it. That's all you need. Because guess what? Most people's careers don't give them that every day. Our career gives us that. That's true. Every single shift. Guaranteed. Guaranteed. And if it's not someone being really nice and sweet, it's a great case. It's a procedure that you did well. It's a diagnosis that you made. It's seeing someone be really sick and then you helped them. Or let's go on a completely different aspect here. You've got a patient who is unruly and rude and nasty, but maybe your maybe that's the case that day that was enriching to you because you were able to handle it really well. You were able to blow it off, not let it affect you, help this person. Whereas on another day, maybe you just would have gotten upset. So that's a win.
Yeah.
And you will have that every single shift, I guarantee it. And most of the time you'll have several good points that are not just good, they're like notable.
Yeah.
And if people knew the kind of impact you had and the kind of impact that people have on your lives, your job would be this like mysterious enigma to people.
Yeah.
And I think we lose track that we are in a career where amazing things happen all the time.
Yeah, that's a really good point. I think that's pretty easy to say because we've talked about it before, but it's hard to actually remember to be intentional about remembering those moments. I read this book called Hardwiring Happiness recently where it talks about how our brains are super focused on the negative all the time. We're always hyper aware of negative things because it's like a protective mechanism, and we don't fixate on the positive things. Even though there's a ton of positive things around us, our brain kind of like sees it as, oh, that was a super nice patient. They were really grateful for the care, and it kind of goes in your brain and out your brain versus the combative patient that's aware on everybody throughout your whole shift. Everyone fixates on that, and then you tend to go home and you remember the negative patient. You don't remember the brief positive encounter. Do you have any ways that like you solidify that in your brain? Because the book talks about how it's kind of like you pause on this, take a few breaths and be like, that was a really positive experience, to try to like get it into your long-term memory as opposed to just letting it pass through your brain. It's in and out in a couple seconds, and then you don't really remember it. So when you reflect on the day, you're like, that was a really negative day, despite the fact that there was some really positive encounters. Is there any ways that you like put it in your long-term memory? Or
yeah, I think you honestly like halfway answered your own question and how you stated it. You have to be purposeful in transferring that experience into your long-term memory, because whether you realize it or not, you are experiencing wonderful, highly enriching experiences in a shift every time, whether you're a paramedic or a nurse or a physician in the ER or the pre-hospital setting. You are experiencing those. The challenge is you have to be purposeful about recognizing it. You have to be purposeful about appreciating it. And you have to be purposeful about reflecting on it. Mm-hmm. So you can experience it, but unless you take it to the next step, then the experience isn't going to mean as much. So I talk about shifts. Everyone's work is different. I work in the emergency room, and you have a shift and you work and you go home. So for me, the drive home is like no one's ever in the car. Sometimes I listen to podcasts, sometimes I listen to music, but I always take that. It takes me roughly 20 minutes to get home after work. So during that time, I breathe slowly, deeply, just kind of relax a little, especially if it's like an evening shift going into the night. And then I reflect on my shift, like what was really cool, what was enriching, what do I need to improve on? It doesn't have to be some like major formal debrief. It's just purposeful recognition.
Yeah.
And then you can change that into like, okay, I'm also going to decide to let go of the things that were frustrating me. And when I walk through that door and see my wife, it's not going to be a husband who's frustrated and irritable. It's going to be someone who worked hard and is grateful that I have a wonderful job, and even more grateful I have a wonderful family, and I come home to that. Mm-hmm. But if you don't do these things on purpose, they're not going to happen.
Yeah. Yeah, leaving work at work is so important. You don't want to walk through your door having all that weight on you from your shift, So I think some intentionality is super key.
Yeah, and when it comes to being grateful and, what are some of the other synonyms, like appreciating things, like a lot of people have a mindset that those kind of things just happen and you feel what you feel. The reality is you have to try to feel that way. You have to try to be appreciative, and it takes a little practice, but it really works.
Yeah. Do you find that it's helpful or unhelpful to like share the stories of the day with your spouse?
Yes. It just depends on what. I mean, some cases, yes. Some generalities, yes. Some no. I want to make sure I don't bring my work home, but I also want to let my spouse know that I'm human, and I want her to know that she helps me, even if it's not comforting in an emotional hard time. It's just understanding and being a smiling face and a good hug to come home to. But you've got to kind of balance it out, because you don't want to like get in the weeds of the details of everything, because these people, oftentimes your significant others, don't know all the details of medicine, and just like a very brief overview of certain things. And then also, I don't want to spend my whole time talking about work.
Yeah.
I want to talk about it some,
Yeah.
and maybe let my spouse know what was challenging for me or what was rewarding, but keep it pretty brief and not super detail oriented, and then quickly turn the focus on to whatever else it needs to be.
Yeah. Yeah, I always go back and forth whether it's worth like sharing the details or the minutia of like what was frustrating about a day. I feel like as men, like we can't even necessarily specify what it was that was frustrating about the day. Like I usually just say, oh, it was busy. So it was hard because it was busy, even though it's always busy. Like that's usually not the problem. It's usually like a frustrating case, a frustrating specialist or something like that actually made me frustrated throughout the day. Not so much the busyness of the ER. But usually that's like kind of my general response is like, yeah, it's busy. So, I'm tired, I'm frustrated. And that's kind of as much detail as I go in. But sometimes I wonder if being more specific about this frustrated me, because my wife's great at that. She can pinpoint, very specific things throughout her day. The kids did this, that frustrated me. They made a mess of the house. And she can really specify what made her frustrated. And me, at the end of the day, I kind of just have this general sense of like, that was a frustrating day, and I can't necessarily pinpoint, or I don't get into the minutia. And maybe that would help sometimes. I don't know.
Yeah, I try to keep it pretty brief,
Yeah.
but enough to give them sense of understanding, because a lot of times they're curious more than what we think they are, because this is just normal life for us. But I try not to just talk nonstop about work.
Yeah, you don't want to just unload on them, and
Yeah.
I don't think that's super healthy either when you just come in and you talk for an hour about how frustrating your day was. That probably doesn't help you get over it either,
No.
when you're just rehashing and, yeah.
When you're just ruminating on things.
Right. Is there anything as a physician that is tough each day that maybe the rest of the staff doesn't see from that particular role? Is there anything about being a physician that's uniquely challenging in the ER?
Oh, man, that's a good question, because I know there's several things, but it's honestly hard to just kind of pinpoint. I think that, like, as a physician, you are really responsible for the totality of every single thing in that ER at every minute of your shift. And that's hard because nurses have their assignments. So they have these beds or these patients, and paramedics in the emergency department are oftentimes more task oriented. So they have oftentimes more more involvement with a higher number of patients than the doctors do, but their role is limited. They're there to do this task or that task and then move on and do another task with another patient. And as a physician, you're responsible for everything. And a lot of times people don't understand that. So when it's not just like I'm seeing this patient and that is my duty and that is the only thing that I'm doing right now. The reality is that's not true. I'm concerned about the waiting room. I'm concerned about the patients waiting. I'm concerned about the ambulance coming in. I'm trying to balance everything out with the timing, with the resources that are constantly changing. How many nurses called off that day? Is the CT scanner out of order for a certain period of time? Or you're not able to get a hold of consultants? So as a physician and a physician assistant or nurse practitioner, any of those roles, you have this utilitarian duty to that entire department. And that's hard because you want to spend the maximal amount of time and the maximal amount of effort with each individual patient. But oftentimes when you do that, you see that you're failing in your bigger role of managing the entire department.
Yeah. Yeah, I see that true, especially when I work like a fast track type shift where it's a bunch of low acuity patients. You tend to have like this big waiting room of patients that they're waiting for results to come back to get them in a room. And you may have like only 3 or 4 patients roomed, and the rest of the staff is like, well, you only have 3 or 4 patients roomed. Like, why are you kind of getting stressed out? And I'm like, well, I have 10 patients that are waiting to get roomed. I've already, reviewed their chart. I'm looking at what got ordered, and I'm waiting for them to be resulted. Like, my mind is on 14 patients, not the 4 that are currently roomed. And so that makes a lot of sense, because you're like, it's a little more overwhelming maybe than people see, because you're fixated on 14, 16 patients, some of which are not in a room yet. And you're not just focused on the couple patients that maybe are in your rooms.
That is definitely true, and we all feel it. And I honestly don't think a lot of other roles in the medical setting truly understand the depth of that and the importance of that. So, for example, let's say I'm in like a lower acuity area, and I've seen and evaluated a patient who has flu-like symptoms, nothing dangerous whatsoever. They're not even really throwing up or anything, but the patient wants IV fluids, right? Is that a bad ask? No. Is it a high-risk thing to give someone IV fluids? No. Is it a completely reasonable ask, and would it make them feel better? Probably a little. But if I've got a waiting room of people who are waiting 3, 4, or 5 hours, and I've got sick people that need to be taken care of, maybe not giving the liter of fluids to the person who has just a virus, maybe that's a decision that needs to be made. And in doing so may upset an individual, but it will benefit quite literally maybe 10 to 12 other people in that time. And those are the kind of decisions you need to make. That is a very basic like explanation, but it's things like that all the time where you're balancing that out, that for other people, it like, this is their assignment, and their job is to take care of the people and make them happy. And so if they had that request, it may seem a little callous for me to decline it, but there's always a reason why, if that's the case.
Right. Well, I mean, the ER bed is one of our most limited resources. There's going to be somebody else that needs that bed, that's waiting for that bed. It could be the next ambulance, could be the next person that checks into triage. So it's such a limited resource. You have to protect it and not, give a liter of fluids that takes an hour to go in, and you're tying up that bed for probably somebody that could drink some fluids at home.
Right. If they're able to orally rehydrate, the fluids make you feel better for a little while, but drinking 1 liter of fluids is the exact same as getting a liter of IV fluid.
Yeah.
The outcome is the exact same.
Yeah, it turns out there's nothing magical about it going in IV.
There's not.